I'm Julie Barkey with Senate Update. From two-way video conferencing to sending medical information using the internet, telemedicine is widely used across the state. A bill carried by Senator Julie Rosen would provide parity in how those services are billed to insurance. And there are three key components to the Telemedicine Act legislation. What are those?
Well, the Minnesota Telemedicine Act is a piece of bipartisan legislation that's very important to pass this year in order to bring parity for services that are provided by telemedicine in our health by our health providers. And it's a wonderful expansion of coverage, our ability to make sure that we can bring proper health care to the areas that do not have a specialist but have to have a specialist. We want to keep our patients at home in their local community hospitals. Telemedicine is a wonderful opportunity to do that. It has cost savings, better health care is provided, and it also deals with the shortages of our specialists and some of our providers, especially out in greater Minnesota.
And because of this expansion of insurance coverage, are you finding that insurance companies are on board with this, or is there some pushback?
Well, that's a very good question, because the hearing, I believe, is going to be next week in Senator Sharon's committee, Health and Human Services Policy, and I haven't heard anything from the insurance companies, the commercial plans at all. I believe that they know this is coming. It's a wonderful ability to make sure that healthcare delivery is across the board and there's parity. So if they have a problem, they should show up very soon, but this bill has been out for quite a while, and obviously there is no problem.
Let's talk a little bit more about that. Are there considerable problems with the current system? Are you finding that there are patients who aren't being covered or not getting the kind of treatment they need?
Well, when it comes to telemedicine, we really don't have a figure as far as how much it's being used. We do know that at times it is not used because there's uncertainty whether it is going to be covered by the plans. So this just makes sure that we have the ability to provide proper care in areas that lack a specialist on site, but even HCMC was talking about how important it is to get to those folks that have the inability to come into the clinic or to the hospital. We're talking about our aging or disabled, and in greater Minnesota, it's for that extra layer of support system for the local provider to have, such as a Mayo or a Sanford or a Vera, to go to and say, I need a second set of eyes. What's your opinion? We've seen great use of it with telestroke, because you cannot have a neurologist in every community hospital, but you can have that expertise at the originating site, or the site like Rochester, where they have those specialties.
And finally, there's bipartisan support on this. How optimistic are you that this will make it through?
Oh, I'm very optimistic. We have some wonderful authors on the bill. We have Senator Clausen, who deals specifically with the workforce shortage issues in greater Minnesota. We have Senator Lori, chair of Health and Human Services budget, and Senator Eakin, who also feels and knows about these issues of healthcare delivery in greater Minnesota, and then Senator Nelson, who represents the Mayo Clinic. So some very good support. As I said, I haven't seen any opposition, and we are also dealing with the Medicaid population in this bill too. There might be a little bit of a fiscal note, but we haven't seen anything yet so far. So I'm excited to see the savings too.
Thank you, Senator Rosen.
Thank you, Julie.